Thanks to the actions and the ongoing commitment of Ontarians, our province continues to have the lowest rate of active COVID-19 cases among all provinces outside of Atlantic Canada at 89 cases per 100,000 people. We can compare that rate to 128 cases per 100,000 in Quebec, 165 cases per 100,000 in British Columbia, 249 cases per 100,000 in Saskatchewan, 305 cases per 100,000 in Alberta, and 634 cases per 100,000 in Manitoba. In fact, outside of Atlantic Canada and the Territories, Ontario has the lowest rate of COVID-19 cases per 100,000 anywhere in North America. These are the facts, plain and simple. As the Premier said yesterday, though, this is not something to brag about. We continue to face serious challenges. However, today's Auditor General's report is a disappointment and, in many respects, a mischaracterization of the province's pandemic response. The reality is that over the course of the pandemic, there have been differing views among public health officials, amongst the medical community, amongst policymakers, and of course the public. And while we welcome certain of the recommendations from the Auditor General, many in areas where we were continuing to make improvements, we have different views on various aspects of her report. No jurisdiction is perfect, and we are certainly no exception. But our job in such an unprecedented crisis as this one is to make the best decisions we can with the best available information, and that we have done. Since COVID-19 was first identified as a public health issue, Ontario has taken rapid action on all fronts to respond to this extraordinary challenge. Thanks to the efforts across government and with the guidance and advice of our public health officials, including and especially our Chief Medical Officer of Health, Ontario has been a leader in our pandemic response. We have built an extensive provincial plan to protect Ontarians throughout this outbreak, and we have been unequivocal in our commitment to protecting the health and safety of all Ontarians. In early January, we acted immediately to designate the 2019 novel coronavirus as a disease reportable under public health legislation, enabling local public health units to quickly and effectively take all necessary measures to investigate, complete lab tests, and do case and contact management to prevent and further control spread of this disease. We were one of the first provinces to declare a public health emergency, just after Quebec. We ensured that anyone in need of care can receive it by waiving the 3-month waiting period under OHIP for OHIP coverage, as well as covering COVID-19 related expenses for those who are uninsured. We have worked relentlessly to deliver personal protective equipment and other critical supplies to the province's frontline healthcare professionals and other frontline workers. We eliminated an outdated public health information system, launching a new system customized for Ontario in record time. We have created an army of contact tracers to support public health units in contact tracing, and we launched COVID Alert, the country's Made in Ontario exposure notification app. We have established an integrated provincial lab network among public health, hospital, and community laboratories, working with our partners to create unprecedented testing capacity. In the early stages of the pandemic, our province had the capacity to conduct 4,000 COVID-19 tests per day. Now we've completed nearly 6 million tests to date, more tests than all Canadian provinces and territories combined. We have the highest per capita rate of testing in the country. We have invested over $2.5 billion to support hospitals throughout the pandemic and build capacity. This includes more than 3,100 new beds at 57 hospitals and alternate health facilities throughout the province. Beds that help with occupancy pressures and support the continuation of surgeries and procedures that had to be postponed during Wave 1. We have been decisive at every turn to protect the health and well-being of Ontarians, including moving Toronto and Peel into lockdown this week. This pandemic has presented tremendous challenges to health experts and government decision makers around the world due to its unprecedented impact and complexity. But our response has always been informed by evidence, assessment of risks, and local context, and we have benefited greatly from the advice and recommendations of our public health officials. And we will continue to work with them to confront and defeat the challenges posed by COVID-19. Thank you very much.